Have you ever caught yourself wondering if the anxiety you feel is just a common response to stress, or if it might be hinting at something deeper? Many of us, especially during major life changes, whether a new marriage, kids, or a career milestone, experience this ongoing restlessness that seems hard to shake off. But is it normal? Today, we'll dive into the different levels of anxiety, from mild to when it becomes a disorder. Watch until the end to figure out where you might fall on the spectrum. Before we break down these levels, it's crucial to understand that anxiety is a natural response to stress. It's that alert signal preparing us to face or avoid dangers, a reaction that we all experience from time to time. In healthy doses, anxiety helps us tackle challenges, from solving problems at work to taking care of family or adapting to life changes. However, this response can become exaggerated and constant, surpassing healthy levels and beginning to impact our well-being. When that happens, anxiety goes beyond a simple reaction to stress and needs more attention. Recognizing this difference is the first step toward evaluating anxiety with awareness. Now that we understand anxiety as a natural response, let's examine how it shows up. Scientific studies and clinical practices show that anxiety manifests at various levels, from a normal, fleeting reaction to disorders that deeply affect quality of life. Based on classifications by organizations like the American Psychiatric Association and the World Health Organization, we'll explore these levels to help you better understand how anxiety may appear in daily life. Normal anxiety. This level of anxiety is what everyone feels in new or challenging situations. It's a healthy and temporary reaction, like before an important meeting, tackling a new task, or handling an unexpected situation. Common signs include a slight nervous flutter, alertness, sweaty palms, or a slight increase in heart rate. These symptoms usually fade once the event is over. For example, speaking in public might make your legs a bit shaky, but the feeling disappears as soon as the presentation ends. Normal anxiety acts as the body's natural alarm, helping keep you focused and attentive. Mild anxiety. Mild anxiety goes beyond specific situations and becomes a more constant presence. At this stage, anxiety starts to pop up throughout the day, subtly but repeatedly. For instance, a mother who frequently worries about her children's health might feel a slight tension in her chest when thinking about daily responsibilities. Other signs include slightly faster breathing, a persistent sense of unease, or a mind that keeps running what-if scenarios. This level of anxiety doesn't stop a person from completing tasks, but creates a tension that resurfaces, especially when reminded of responsibilities. Moderate anxiety. Here, anxiety starts to directly interfere with relaxation, even in moments that should be peaceful. Anxious thoughts become frequent and hard to shake off. A person might notice that while trying to rest or sleep, their heart beats faster, muscles tense up, and sleep is interrupted by worries that seem uncontrollable. Physical symptoms like recurring headaches, stomach discomfort, and muscle tension start to show up and become harder to ignore. Plus, social events and commitments that were once enjoyable might begin to bring a sense of dread, as if something bad could happen. At this level, anxiety has a visible impact on daily well-being and quality of life, making a person feel like they're constantly on edge. Severe anxiety or anxiety disorder. This is the most intense level of anxiety, where it becomes debilitating and starts to take over all aspects of life. Intense worries and fears often arise without a clear cause, preventing a person from carrying out routine activities. For example, someone with severe anxiety might avoid places they once frequented with ease, like the grocery store, social events, or even work, due to fear of feeling unwell or facing difficult situations. Physical symptoms are common and can be overwhelming, including a rapid heartbeat, excessive sweating, trembling, feelings of faintness, and even chest pain that can resemble a heart attack. At this level, anxiety restricts a person's freedom, making simple activities exhausting and complex. Managing severe anxiety or anxiety disorders requires professional support, as symptoms can be persistent and hard to control alone. While there are various strategies to manage anxiety, it's important to recognize when it becomes more serious and begins to heavily impact life. Certain signs indicate it may be time to seek help. If anxiety is making daily activities challenging, affecting work, relationships, or your ability to complete basic tasks, it might be time to consider consulting a specialist. Symptoms like frequent panic attacks, prolonged insomnia, loss of appetite, or intense fear of everyday situations are indications that therapy or medical help may be essential. Seeking help is not a sign of weakness, it's an act of courage and self-care. Professional help can offer personalized techniques, therapies, and in some cases, medications that bring relief and promote a more balanced, healthy life. Share in the comments which level of anxiety you relate to. Remember, anxiety is a natural response, and we all experience it at some point. By learning to identify and manage these signs, you're strengthening your well-being and fostering a more peaceful, balanced life. If this content was helpful to you, subscribe to the channel and share this video with anyone who might benefit from this information. Stay tuned for upcoming videos, where we'll be sharing practical tips on managing anxiety in everyday life.
See you soon.